Okay.
Okay.
Hi, my name is Abby Morgan. I'm going to be performing, I'm a PA student. I will be performing your pulmonary, cardiovascular, and abdomen exams today. I'm going to go over here and just wash my hands. I'm going to use hand sanitizer today. All right, so patient appears to be a young, healthy Caucasian male, no apparent distress. If you could remove your shirt for me so I could perform this exam. All right, perfect. So I'm going to start by inspecting the anterior and posterior diameter of the thorax. I'm inspecting for symmetry of anatomy, contour, AP diameter, skin lesions, any superficial veins, lesions, and then I'm going to look for central cyanosis on your lips and your mouth. All right, so no abnormalities are noted. When it comes to the back of you, and I'm going to just squeeze at your teeth, around your T10. If you could take a deep breath in. All right, chest expands symmetrically. Perfect. So now I'm going to have you cross your hands like you're hugging yourself, and I'm going to palpate. I'm palpating for any deformities, any step-offs, any crepitus, masses, tenderness. Nothing is noted. Now I'm going to test for tactile fremitus. Just say 99 when you feel my hands.
99, 99, 99, 99.
All right, perfect. Tactile fremitus is equal in all fields. And now I'm going to test for your diameter. I'm just going to palpate for it, or percuss for it. Okay, now take a deep breath in, all the way, hold it. Okay, perfect. And now breathe out, and now take a breath, and exhale all the way. Okay, so here, now I'm going to take my ruler. I'm just going to measure. All right, so diaphragmatic excursion is 5 centimeters. And now I'm going to percuss your back. So I'm just going to have you still cross your hands, perfect. So all right, so no dullness to percussion. Now I'm going to test for CVA tenderness. Just tell me if this is tender. All right, so no CVA tenderness. And now I'm going to auscultate. Just breathe every time you feel my stethoscope on your back. All right, perfect. So no adventitious sounds that were heard. Now I'm going to put on my gloves. I'm going to have you hold your hands up on my shoulders, on the side. You put on my shoulder. All right, I'm going to just palpate your anterior axilla, your central axilla, your posterior axilla, your lateral axilla. So no lymphadenopathy in your anterior, central, posterior, or lateral nodes. All right, perfect. Now I'm going to go back to your back. I'm going to do a special adventitious sound test. It's called egophony. I'm just going to have you say E every time you feel my stethoscope on your back.
E, 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 E.
All right. So results of that test were normal. There was no abnormalities to that. All right, so now I'm going to come to your front. I'm going to have you actually lay down flat on this table. All right, perfect. So I've already inspected. Now I'm going to palpate your anterior chest wall. Just looking for any, or there's no masses, no crepitus or tenderness. All right. Now I'm going to start percussing. If you could look to this way so I could percuss. Okay. Perfect. And the other way. All right, so no dullness to percussion. And now I'm going to listen. Every time you feel my stethoscope on you, just take a deep breath, okay? All right, so no adventitious sounds were heard. Okay, so now I'm gonna have you sit up. Perfect, so now we're gonna move into the cardiovascular exam. So first I'm just going to feel around for your carotid artery. I'm gonna palpate your carotid artery on this side. All right, now I'm going to listen to it with my bell. If you could just hold your breath when you feel my stethoscope on you. All right, so no bruits were noted. Okay, so now I'm going to just stand in front of you. Now I'm going to listen to all of your sounds starting on your second intercostal space. Well, first I'm going to feel for your angle of Louis. I'm going to go to your second intercostal space, which is right next to it, and listen to the right lateral side of your sternal border for your aortic valve. Your pulmonic valve on the second intercostal space on the left sternal border, your Erb's point at the third intercostal space at your left sternal border, your tricuspid valve at the fifth intercostal space of your left sternal border, and your mitral valve at the fifth intercostal space at your midclavicular line. Now I'm going to use my bell. I'm going to listen to your aortic valve, pulmonic valve, Erb's point, your tricuspid valve, and your mitral valve. All right, perfect. So now I'm going to use my diaphragm. If you could inhale completely while I listen, and hold it. All right, perfect. So there is physiologic splitting. And now I'm going to have you bend forward, exhale completely, and I'm going to listen, hold it. All right, perfect. No murmurs of aortic regurgitation. Now I'm gonna have you bear down, plug your nose and blow out. All right, perfect. No murmurs upon Valsalva. And now I'm going to have you lay down. Oh wait, actually first I'm going to put this here, these pillows, because I want you at an angle. Perfect. So first I'm going to have you go back. I'm going to, if you could look to the left side, please. I'm going to put this ruler at your angle of Louis. And then I'm going to first actually look for your internal jugular pulsation. All right, it's right around here, your angle of Louis. All right, so internal jugular pulsation is 1 centimeter above the angle of Louis, while the patient is sitting at 30 degrees. And now I'm going to use my tangential lighting. I'm going to be looking for any precordial heaves in your PMI. All right, perfect. Now I'm going to palpate all the areas. I'm looking for any lifts, heaves, or thrills. And then the PMI is non-displaced. All right, perfect. Now I'm going to start listening. I'm going to start with my bell. I'm at your aortic valve, pulmonic valve, your Erb's point, your tricuspid valve, and your mitral valve. Now listen with my bell. So your aortic valve, your pulmonic valve, your Erb's point, your tricuspid valve, and your mitral valve. All right, now I'm gonna have you turn a little bit to the left while I look at your Erb's. If you can inspire or breathe in all the way and hold it. All right, perfect. There are no gallops. There are no gallops heard. Okay, now I'm going to, okay, so rate and rhythm were regular. There were no murmurs, gallops, or rubs present. All right, so now I'm going to have you sit up, please. I'm going to start checking all of your pulses. So I'm going to start with your carotid pulse. I'm going to start on the side, your left side. Perfect. This side. Perfect. Your brachial, I'm going to start on this side. Perfect. Perfect. Then I'm going to do the radial. Okay. And then your radial, it's fine, I can feel it. Perfect. I'm going to do your popliteal. Alrighty. Alright, your dorsalis pedis. And then your posterior tibial. Alright, pulses are equal and full bilaterally. And now I'm going to move into your left, I'm going to look at your fingers first. So I'm looking, there's no peripheral cyanosis, no clubbing. And then, let's see, cap refill less than 2 seconds. All right, perfect. Now I'm gonna look at your legs. So I'm looking for edema, for the hair distribution. I'm just looking at like the skin, any tenderness and masses. All right, nothing is noted. Or any viscosities, and then temperature. Using the back of my hand to feel for temperature. Perfect. Now I'm going to move into the abdominal exam. So I'm going to move these pillows. I'm going to have you lay all the way down. All right, I'm going to have you lift up your feet. So for the duration of for the rest of this exam, I'm going to have you laying down with your feet like that. Your abdomen is already clear for me to do all my examinations on. So you are prepared for this exam. So I'm just looking at your abdomen. I'm looking for, or your abdomen is flat. It's flat, non-distensible, without any lesions or striae. Now I'm going to listen for your bowel sounds. I'm going to listen in the right upper, your left upper, your left lower, your right lower, your epigastric, your periumbilical, and your suprapubic. All right, bowel sounds are present. Now I'm going to listen to your abdominal aorta. I think I used the bell. All right, your renal arteries. Your iliac arteries. All right, perfect. So now I'm just going to palpate, first with the arteries, there was no, there was no, everything was normal there. I'm gonna palpate all of these. All right, so Everything is normal. I'm going to now percuss. I'm listening for any dullness or tympany. In all the quadrants and regions. All right, nothing is noted. Now I'm going to listen for your liver. I'm going to start down here. I'm listening for dullness. Oh, whoops, I was using the wrong finger. I'm going to start over. All right, here's the first sign of dullness. So now I'm going to mark it. All right, dullness from here to here. Gonna measure. Okay, your liver span is 8 centimeters. And now I'm going to move over to your spleen. I'm starting at your 6. All right, if you can breathe in, take a deep breath in and hold it. All right, no splenomegaly is noted. Now I'm going to move on to, I'm going to feel for rebound tenderness. So I'm going to go over here. No, you're right lower quadrant. I'm going to feel for rebound tenderness. That's your left. Yeah, that's your left. All right, you're right. Lower quadrant for rebound tenderness. Is this tender? No? Okay, so no rebound tenderness. And now I'm going to move and I'm going to feel for your aorta, your abdominal aorta. I'm gonna press in. All right, it's right around here. So. All right, your abdominal aorta is 3 centimeters in size. There is no lateral pulsation, and then I'm going to do some light palpation. I'm just feeling. So there is no tenderness, masses, guarding, or rigidity. Now I'll do some deep palpation. No tenderness, masses, guarding, or rigidity. And now I'm going to palpate for your liver. Your liver, yeah. So I'm going to just try and hook myself under. And if you can take a deep breath, inhale. All right, perfect, breathe out. So liver is non-tender, non-palpable. And then over on this side, I'm gonna have you turn a little bit. I'm gonna try and lift it up and feel under. If you take a deep breath, spleen is non-tender and non-palpable. Perfect. And now I'm going to see for abdominal reflexes. All right, perfect. This is the time when I would normally do my genital, my rectal, and my hernia exams. I'm not going to be doing that today. Also, I forgot to, or when I was testing over here and I was listening, I'm gonna listen again with my bell. So your abdominal aorta, your renal arteries, and your iliac arteries. All right, there is no bruits present. And then also, this is when I would listen for the femoral, I would listen for femoral pulse, but I'm not going to do that today. So femoral pulse is equal and full bilaterally. No inguinal adenopathy is present. All right, so now I'm gonna have you sit up. I'm gonna do my last exam, or actually back down, my bad. So now I'm going to go up here. I'm gonna have you inhale deeply. I'm palpating. All right, perfect. Any tenderness? I'm looking for any cholecystitis. You can breathe out now. All right, that was the Murphy's test, and Murphy's test was negative. And now I'm going to press down on your left lateral. Is this tender? I'm doing Rob Singh's test right now. And then when I lift up, anything tender? All right, so negative Rob Singh's test as well. And now I'm done.